So, yeah, of course, that's fine. Yeah, that's fine. So, yes, we did. Hi. Come on in. Okay, thank you. Sit here. I'm just explaining. I'm just explaining. I even brought the letter for you. The appointment, which is good. I've got the letter here. Which is great. A lot of you to get organised.
And you made it on time. You've done well.
Yeah, thank you.
How have you been?
I've been pretty terrible. I'm currently suffering from very severe urinary incontinence, and also some very severe gut issues as well. In fact, this is the most important thing I need to show you today, and sadly I don't have the other document I wanted to show you. But this is important because I have to pay. I've just spent £250 on seeing a private doctor. I have got it, that's good. I spent £250 seeing a private doctor. This test cost me £250. This test here cost me £120. The second page of this test is here.
This is for the urine?
Yeah, you're welcome to have a right
through. Oh, urine, okay.
Yes, but it does indicate some gut issues. And then this test here cost me another £120. So I've spent probably upwards of £1,000 on private healthcare to both try and rectify my gut and my urinary incontinence issues. So I've also got this from my GP which said that there was mixed growth. And the reason I'm mentioning this to you, Dr. Advocacy, is because of the fact that these bacteria, for example, if I show you on this report here from Focus Laboratories, which work with Advocacy, so I've got peptonophilus neuritis currently that hasn't been treated.
That's in your urine, isn't it?
Yeah, but then I've also got what was most concerning is this was the Klebsiella, Pseudomonas and Enterococcus. I've been told on about 4 different occasions that usually they're found in the gut, usually they're found in the intestine, and a lot of these bacteria, so these are all the bacteria that were found in this test, and then these are all the bacteria above the threshold, so Gardnerella vaginalis, Enterococcus faecalis, and Peptonophilus neuritis, they were all above the threshold of 10,000 CFUs. All of them, and then for these were all also above the threshold of 10,000 CFUs, Pseudomonas, Klebsiella and Enterococcus. So I've got 3 here that have been flagged, 3 here that have been flagged above the threshold, and then Feingoldea magna, Lawsonella clevelandendis, Anerococcus chesiensis, Abasiensis, Streptococcus pastorianus, and Anerococcus vaginalis, and Actinomyces racidentis. These are all worth treating, so if I direct you to this bit here, it says that there's either suggest treatment, consider treatment, or monitor. A lot of these, so that's 1, 2, 3, 4, 5, 6, 7, 8, 9, about 10 different pathogenic bacteria. These are not just this is not healthy bacteria, this is not friendly bacteria, this is pathogenic bacteria, and a lot of them are just supposed to be in the gut, and a lot of them are in my urine, and that does really, really strongly indicate to me, A, I've got a very severe infection, which I've not received treatment for, which is getting worse. I'm now having to wear adult incontinence nappies. I cannot sleep, not even barely an hour. I'm literally unable to work. I'm unable to care for my child. I'm unable to do anything. And for example, I'm desperate to get the gut issues fixed. So yesterday I was on Bladder Health, so Focus Laboratories, Digital Microbiology. There were 2 organisations that I was recommended by a private doctor through DAYE, which is this women's health company here that talks about the microbiome, which isn't as important, although it did diagnose me with BV. But So I've done 2 of the tests now. So Bladder Health UK, they're an organisation. They work with 3 different organisations. They recommend 3 different online testing providers. Focus Laboratories, Digital Microbiology, and the third one is one based in America. So that would be the last option. That would be the last resort for me. I went on the website and did some research. They have a partner in the UK called Regenerous Laboratories. I went on the Regenerous Laboratory website and they've got an instant chat messenger, and I said, I'm having a lot of gut issues, what would you recommend? The test was £350 to check for your digestive health, to do, fecal sample screenings, to do, saliva swabs, and, blood tests, and urine samples, whatever you have to do to work out whether you've got any, foreign pathogenic, infections or inflammation in your gut lining that's potentially spoken to a lot of doctors who are, I've had about 4 doctors here. Dr. Kazan said to me, yeah, it's very bizarre because you have got a lot of bacteria in your urine that's usually just in your gut. And he couldn't quite work out why it was that it was making its way into my urine. So I do think that there's something wrong. And you know, it seems to be that urology is thinking it may be more of a gastroenterological problem due to the fact that a lot of this bacteria is going into my urine. And I know we have done some tests, but they were quite a while ago now, they were like 2 years ago. And for example, like, there are a lot more tests to be done to rule out other things. And I think with the indication, like for example, it's most important, I need to read you what it says here. So it says, although cyclofloxacin is reported as intermediate due to UCAS laboratory reporting guidance, it would possibly be an effective treatment in a clinical situation. So cyclofloxacin is an extremely heavy-duty antibiotic. In a situation where there are no other antibiotics readily available and the patient has no allergies, contraindications to taking cyclofloxacin, this may represent, and this is the key bit, this may represent a useful alternative to the IV antibiotics mentioned above. So this doctor here, Dr. C.S. Anderson, who's got a certificate in menopause care, GP with specialism in women's health and urogynecology infections, this test, and I just have to really, really make this is the most important thing I'm going to say in this appointment today. So this test was received, the date of this report was the 20th of January 2026. So it's now the 1st of June 2026. I am holding here a report which says that Dr. C.S. Anderson said that as of the 20th of January 2026, I should have been given IV antibiotics to treat these pathogenic bacteria. I haven't been given IV antibiotics. So as I'm sure you can appreciate, because this is my body and I know what I'm experiencing, you're not seeing that right now, you're not seeing me at home in the nappies, you're not seeing me not sleeping all night, you're not seeing me in pain, you're not seeing the amount of painkillers I'm taking, you're not seeing the thousands of pounds I'm now trying to spend to get this resolved. You're just here with me today having not seen me in 6 months. So it's very difficult for me to translate to you the distress I'm in, because unless I wail on the floor and have gushing blood, it seems to be very difficult as a woman to get taken seriously. But I am in a lot of distress, and I have got a report here saying I should have been on an IV drip at the end of January. It's now 5 months later, I haven't had the IV drip. I'm being treated like a guinea pig, being given all these different antibiotics without actually any indication that they're going to work. And I need something now to be, because this really is getting really serious now. Like I'm literally in incontinence nappies now. Like that's an emergency, you know. I have got a doctor on at the moment wanting to book me an appointment for an emergency, but that's going to cost me another £100. So I'm rather thinking, I am an NHS patient. These things really should be being resolved by the NHS. Because I'm in an emergency right now, you know? So I just want to make that really clear that this is a classified emergency. So, you know, the doctor's aware of that. The NHS is accountable for the fact that I'm currently suffering from an emergency, and I just want to make that really clear.
Okay, so from my perspective, a lot of this is to do with the urine, so I cannot be involved in this, in getting in for intravenous antibiotics to treat this. Also, the trust will have guidance on who needs intravenous antibiotics, what lab results are relevant. So, but this isn't really my expertise. You have seen a urologist and a gynecologist. I can't be involved in this. These results are to do with your urine. I'm a gut specialist, not a urine specialist. So I'm not in a position to give you antibiotics for this. This needs to go through the appropriate channels if they feel this is correct, because there are some.
Well, the first thing Regeneris Lab said to me when I said I was suffering from incontinence, the first test they suggested to me was the gut 360 test.
So these tests are not validated. We don't believe in them in the NHS. I'm sorry that you have to pay all this, but I cannot act on something that's done privately that isn't validated. I mean, the gut is full of millions of bacteria. This is normal. They are bacteria.
No. Sorry, I have to interject there. No, we're not talking about friendly bacteria. We're not talking about we're talking about pathogenic bacteria. There is a difference between friendly bacteria that naturally exists in the gut and then pathogenic bacteria, which is often linked with infections.
But the gut is filled with millions of bacteria, some good, some bad, and it's about keeping the balance between the two. But based on my expertise in gastro and these results that you give me, I can't act on these results. I just want to be clear with you. There may be other pathways you can go, but I'm not the right specialist for this.
That's absolutely fine. and I appreciate your response, but what I would say, as a fully qualified doctor, it's very concerning to me that you are completely ignoring all of these tests. No, let me finish. Because as a fully qualified doctor, bearing in mind my brother works for the NHS, he has done for 8 years. What you should be saying as with patient care is, I'm really sorry you've been through this. This must be incredibly distressing for you. If this was my daughter and she was going through this, I would be so worried about her. Now, I am a gastroenterologist, so there's only so much I can do. But based on what you've told me about the fact that Klebsiella is usually found in the gut, what we could maybe suggest is this referral or this test, or we could try this or rule this out. Now, what you've come back with me today, Dr. Alakari, is very concerning. This response has not been a professional response. You've not at all validated the distress I'm in, the physical discomfort, the symptoms I've told you about, the indignified state I'm currently in due to an infection which is outlined in all of these reports, which I have laid on the table here. This is not a good response, Dr.
I'm sorry to feel that way, Shall if you're not prepared, shall we end this conversation?
No, absolutely not. I've been very polite today. I've said I've travelled here today, I've paid for childcare today, I've given you all of these reports, I've spent thousands of pounds on private healthcare, and I would like some answers today, and I would really like for this doctor to not allow me to walk out of here for the 6th time of me seeing her with no movement and no plan to move forward with my infection.
I'm sorry, this is not for me to treat. I'm really sorry for the distress. I'm really sorry that you've gone privately.
Okay, let's at least decide then. What about why am I here today then? Why on earth am I here today?
So this is not for you to treat. Everybody is not allowed to see from the last time. Okay.
Right, I'm feeling a bit intimidated by you.
Yes, that's fine. So it was to do with talking about the colonoscopy.
Yeah.
But I had seen now that you've already had a chat with Mr. Massacre that I referred you to the colorectal surgeon and that they're arranging a colonoscopy for you. But this was, you were on the waiting list to come back for a follow-up after the last time we had a chat.
Okay, so I have to correct you, you've got incorrect information on the system. I've not been booked into any colonoscopy.
It was scheduled, but there is a booking for it from the last time you saw the colorectal.
Okay, but I haven't been booked into the colonoscopy. I have no information about
the
that.
information has been put into the system, that's what I
Okay, but okay, so just to be clear, because I have recorded this whole appointment and I'm going to be sending it to a lot of
you
people.
are not allowed to
I have.
This is a legal issue.
Well, I have.
Okay.
But I will be going on social media, so if you're happy, we can entertain the appointment.
Okay,
That's fine. It will be going on